Hello there. In this video, we are going to explore the origins of COVID-19. Where did it start? What effects has it had on humanity? Who lied and why? And what bad side effects do these so-called vaccines have now? These are very important questions because they affect us all. For example, the former Pfizer CEO Albert Bourla recently came out and admitted that the company made many mistakes during the development of their COVID vaccine. This is a very serious allegation because it was rushed through clinical trials with insufficient testing and people suffered as a result. It was a colossal failure, but he says that it was done in good faith and with pure intentions. In other words, he does not admit liability or culpability. They were trying to save the world, but they made some minor slips along the way. Well, if this is true, then it's time for a full investigation. We need to know the truth because it could help improve future treatments. There are two main theories about where the virus originated. The first theory is that it came from an animal source, most likely bats. This is supported by scientists at the World Health Organization. On the other hand, there is growing evidence that it came from a lab in Wuhan, China. A recent study conducted by researchers at Cambridge University suggests that the virus was almost certainly engineered in a laboratory and then released accidentally. If this is true, then this is catastrophic news. The lead author of the paper said, "Our analyses strongly suggest that SARS-CoV-2 is of hybrid viral origin and was the product of an experimental attempt to make an attenuated bat coronavirus vaccine. SARS-CoV-2 is unlikely to be the product of a natural process. Instead, our results suggest genetic engineering." Now, if this is true, then there will be more to come. There will be cover-ups, lies, and misinformation. And unfortunately, it looks like the powers that be are already trying to suppress this information. For example, the American Journal of Epidemiology removed the article without giving any reason. It was supposed to be published there, but then they changed their minds. So now we have no idea where the virus came from. Well, according to the authors, they have uploaded their work to a website called Archive, notably not a peer-reviewed journal, and are currently looking for another outlet to publish their findings. Let's hope they find one soon because we need to get to the bottom of this. Now, when it comes to viruses, it is important to keep in mind that they are everywhere. Most of them are harmless, but some can be deadly. For example, the Spanish flu in 1918 was one of the deadliest disasters in modern history. It infected 500 million people and killed 50 to 100 million of them, which is more than both world wars combined. So this was a major catastrophe. COVID was much less severe, but its impact was still massive. The pandemic began in early 2020 and spread rapidly around the globe. By April, most countries had imposed lockdowns and social distancing measures. This was done to slow the spread of the virus and prevent hospitals from becoming overwhelmed. But it had many negative consequences. For example, schools were closed and children were forced to stay home. Also, many businesses were forced to shut down and people lost their jobs. But perhaps the worst consequence was the isolation and loneliness that resulted from the lockdowns. People were separated from their loved ones, and this took a heavy toll on mental health. As time went on, however, it became clear that the virus was not going away. Even after the lockdowns were lifted, the virus continued to circulate and new variants emerged. This led to a sense of fatigue and frustration. People were tired of the restrictions and the uncertainty of the situation. Some people began to question the official narrative about the virus and the vaccines that were developed to combat it. They began to ask questions like how deadly was the virus really? Were the vaccines safe and effective? And who was behind the decisions that were being made? Unfortunately, these questions were often dismissed as conspiracy theories, even though they were perfectly valid concerns. Now, let's talk about the vaccines. These were seen as the light at the end of the tunnel. If the vaccines worked, then the pandemic would be over and we could all get back to normal, However, there was a problem. As it turned out, the vaccines were not as effective as they were hoped to be. Not only did they not stop people from getting sick, but they also had a number of negative side effects. For example, there were reports of people having allergic reactions to the vaccines. Also, there were concerns about the long-term effects of the vaccines. No one knew what would happen down the road. And as it turns out, many people have been negatively affected by the vaccines. Many of them are now facing serious health problems that they did not have before. And the authorities are doing everything they can to cover it up. For example, the CDC recently altered their data collection forms to exclude mention of vaccines when collecting information on adverse events. This is very concerning because it suggests that the government is not being transparent about the risks of the vaccines. This lack of transparency has led to a loss of trust between the government and the people. People are beginning to wonder what else the government is hiding, and this is leading to a general sense of paranoia and distrust. The pandemic had a profound impact on all of our lives. It changed the way we work, the way we socialize, and the way we think about the future. But as we look back on this time, it is important to remember the lessons that were learned. We must never forget the importance of transparency and accountability in government. We must also never forget the bravery of the frontline workers who kept us safe and the sacrifices that were made by so many others. COVID was a wake-up call. It showed us that we are all interconnected and that we all have a responsibility to protect each other. If we can remember these lessons, then we will be better prepared for whatever challenges may come our way in the future. Let's take the case of SDS, for example. This is a condition that affects young people and causes them to suddenly collapse and die. It is usually caused by a problem with the heart muscle, and it is often fatal. In the past, there were about 30 cases of SDS per 1 million people, but recently there has been a sharp increase in the number of cases. In some areas, the rate has increased to 200 per 1 million people. That's a huge jump, and many experts believe that this is due to the vaccines. Take the case of Denmark, for example. Before the vaccines, the rate of SDS is about 40 per 1 million people. But after the vaccines were introduced, the rate shot up to 700 per 1 million people. That's an increase of 17 times. How can anyone deny that there is a link between the two? Of course, the Danish government tried to cover it up, but the truth always comes out. And it's not just Denmark. Similar patterns have been observed all over the world. The increase in cases of SDS is too much to be just a coincidence. It is clear that something is causing this, and the most likely culprit is the vaccines. However, the authorities are doing everything they can to hide the truth. They are suppressing the data and covering up the evidence. They do not want people to know the truth because it would cause chaos. However, the truth always comes out. And as more and more people learn the truth, they are becoming angry. They are angry at the authorities for lying to them, and they are angry at themselves for being so naive. The level of anger is palpable, and it is only going to get worse. And it's not just the authorities who are to blame. The media is also guilty of covering up the truth. They have published false stories and ignored important facts. They have done this because they are afraid of losing their advertising revenue or being canceled. The media has failed the public, and the public is starting to realize it. Unfortunately, there is no easy solution to this problem. The damage has been done, and it will take a long time to repair. But we must start taking steps to fix it today. We must demand transparency from our leaders, and we must support journalists who are doing their job. We have learned some very important lessons from this pandemic. We have learned that we are all interconnected and that we all have a responsibility to protect each other. We have also learned the importance of being prepared. We must be prepared for the next pandemic that is sure to come someday. It is important to note that not everyone was affected by the pandemic in the same way. Some people were able to work from home and continue making money. Others lost their jobs and their homes. The pandemic had a disproportionate impact on women and minorities. We must remember these disparities as we move forward. We must work to create a more equitable society that is better prepared for future challenges. The COVID-19 pandemic was a tragedy. It caused immense suffering and loss of life. But it was also an opportunity for humanity to learn and grow. We must never forget the lessons of the pandemic. We must also never forget the bravery of the healthcare workers and other essential workers who kept our society functioning during the darkest days. They are true heroes. We are living in uncertain times. There are many challenges that we face as a society, but we are not powerless. We can make a difference if we work together. We can create a better future for ourselves and for generations to come. Let us never forget the lessons of the pandemic, and let us never give up hope.